Hello, I'm John Dimsdale for Health Affairs. In the search for more effective healthcare, researchers have discovered patients themselves hold a vital key. When patients and their loved ones are fully involved in care decisions, when their input and opinions are solicited and taken into account by care providers, research shows that health outcomes are more likely to be successful and even can be less costly. So what resources can patients with little or no medical training call upon to act as healthcare partners? We may have more support systems than we're initially aware of. Take the Care Map, for example. It was developed by Cristin Lind, a mother who was overwhelmed trying to cope with all sorts of medical advice and treatment recommendations for her son Gabe's rare genetic disorder.
So a care map is a picture of all of the people who we rely on to help care for my son.
With Gabe and family in the center, healthcare providers are in blue, school resources in red, support groups in turquoise. It's got 70 bubbles. It's so complex. Were you surprised by that?
I was very surprised to see how complex it was when I was done. And that was my first reaction to seeing it. When I put the pencil down and I leaned back and looked at the whole thing, my first reaction was, oh, that's why I never get to finish folding the laundry. I was kind of a spider in a web, making sure that all of these people and organizations had the right information so that they could, make good decisions and help us make good decisions. So after I made the care map, I decided to share it with my son's doctors. And there was one doctor who we normally met with every 4 months. And within a minute of seeing it, she sort of just exclaimed, "You don't have to come back in 4 months, come back in 6 months." Because for her, she really began to understand that she wasn't the only person who we were seeing.
Cristin Lind's Care Map concept is growing. Dr. Richard Antonelli, a pediatrician at Children's Hospital in Boston, is spreading the care mapping gospel to other families, such as Meri Viano, who cares for 3 children with special medical needs.
I've been intrigued by the use of the care map because when you come to me as a clinician, I have my set of questions. And if you have a care map, you're able to show me, but here's what the rest of my existence looks like, Dr. Antonelli. So tell me a little bit, how have you experienced the implementation of the care map in any of your clinical encounters?
For behavioral health, I believe it's an eye-opener. And I think it's an eye-opener of there's been so many things that you've tried to do or you've tried to find. You've tried to find the support. So those providers are just starting to communicate more with the medical domain with families. So I think we're meeting in the middle on that. So that specifically, it's an education tool.
Hold your breath.
Another way patients can be more proactive in their own care is to participate in clinical trials. Linda Morgan knows that. Morgan is an Asheville, North Carolina pharmacist who's been battling Parkinson's disease for nearly 10 years. At first, she says, her doctor was skeptical that participating in clinical trials would yield any benefits.
When I was first diagnosed with Parkinson's, I wasn't encouraged at all. If anything, I was discouraged to take part in my treatment. Because I was really interested in trials that may be available, and he was so against that.
Morgan rejected his advice and has since participated in over 20 clinical trials. She also runs a local support group for Parkinson's patients and reviews funding proposals for several research centers, including the Patient-Centered Outcomes Research Institute, which emphasizes the importance of bringing experiences like hers into the research process to produce the information that patients and clinicians need to make informed decisions.
I was on a committee of 4, and there was 1 patient, 2 scientists, and another stakeholder. And this committee review team of 4 would review the proposal. And one of the main questions we as patients ask ourselves, would this make a difference to us? If I was in the doctor's office, would this make a difference to me? And that was very rewarding. That was probably the best thing I've ever done, the most rewarding as a patient, because I really felt what I had to say made a difference.
Back at Boston's Children's Hospital, Dr. Richard Antonelli says the new focus on patient activism in healthcare is already showing results.
I think we actually have some early profound evidence around authentic patient and family and caregiver engagement. The evidence shows that patients are much more likely to be adherent to a care plan that they have helped to formulate. Second, the evidence is strong that shows the more patients, families, and caregivers know about their own care needs, the more likely they will be articulate in understanding what motivates or incentivizes them to do better self-management.
While the growing evidence for improving health outcomes through patient engagement is compelling, there are special challenges to partnering with patients in inner cities and in rural areas of the country. In our next video, we'll look at some extremely innovative ideas for bringing patients and doctors together under less than ideal circumstances. I'm John Dimsdale for Health Affairs.